Welcome back to Not Alone with Melissa Sue Methvin. Today we're diving back into the world of dentistry, but with the lens of the nervous system. So many people don't realize that the dental chair is the most fear-decoded places in the body. For others, it's pain, loss of control, or simply not feeling safe or heard in the dental chair. And one thing that's often overlooked in dentistry is that when someone is afraid, they cannot heal properly. Fear shifts the nervous system into survival mode. Blood constricts. The oxygen flow is slowed. Nutrients are diverted away from repair and regeneration, especially in the jaw, the bone, and the tissues of the mouth. So today in this episode, we're going to bridge dentistry and the nervous system. I'm joined today by Dr. DeSanti, a biological dentist here local in Arizona, who will talk about what is the difference of biological dentistry, what are they able to provide there, but also when someone comes into the dental practice, how often as a dental hygienist have I heard, I hate the dentist, I'm afraid, I have dental anxiety. I heard that on a daily basis. Well, guess who holds that pain, that fear? Oftentimes it's the dentist, the dental hygienist, the dental staff that greets them. Now, I've dove into curiosity and connecting the dots as to why dentists are often rooted in pain. They're also depression, burnout, suicide rates are high, just like my husband. But I've also been curious also why some patients have a hard time to heal after root canals, wisdom teeth extractions. And for me, with my own observation, I feel the nervous system has a lot to play in that role. So welcome today, Dr. DeSanti. I'm very honored to have you here, and you are my dentist. So thank you for saying yes to be, well, I'm very, very picky. Ever since I moved here in Arizona as a dental hygienist, I stayed at a temping agency because I didn't want to commit to any office. I really needed to see who I'm going to work with. And oftentimes a lot of people ask me, who do I see? And I am very particular. And you're the one office that really incorporated everything that I'm looking for as far as biological dentistry and root cause healing. So I know my audience, I've had other dentists like Dr. Michelle Jorgensen and Trevor Nichols. But I'd love your point of view of how you can explain what is a biological dentist.
Yeah. No, I appreciate the kind words, and one day we'll convince you to join our office.
Yes.
We'll keep working on that. But what is biological dentistry? Well, first and foremost, it's not what you would call a specialty, right? It's more of a philosophy and a way we practice. But it really dives deep into how the whole body's connected. And it's something, actually, I believe that dentistry should just be this way.
Yes.
Right?
Amen. That's what I am thinking. That's my hope.
It's too often as dentists, we get into the mode of what is coined the term tooth mechanics. And to me, it's not just fix a tooth, see you later. It's, well, why is something happening? What's the root cause of it? How can we get to the bottom of it so that we can prevent it from continuing to happen? And then how can that impact your whole body? And often there's things that are going on in the body that can show up in the mouth. There's things in the mouth that can affect the rest of the body. And so looking through those lenses is, I believe, how you can give the best care and help someone on their health journey.
Yeah, instead of having your patient there and like, okay, there's the symptom, we'll treat that, right? Yeah. There's a cavity, we'll just do that. But you ask more questions like, okay, what's the root cause?
It's more relationship based. And so we we operate at a little bit slower of a pace so that we can dive deeper into those questions. It's not a quick, whereas a lot of the office, most people are probably used to seeing the dentist for 2 seconds and then they're out of the room, right? It's more, okay, what's going on? How can we help you further your healing? It's not my journey, it's your journey, and I'm there to help you, but I'm not the one that's going to tell you what to do, right? Because there's so many different options, there's so many ways you can go about it, so many different techniques, or ultimately there's a lot of different ways how our body responds.
Yes.
And so we just need time to dive into that and figure out you as an individual.
Yeah, for example, like the first initial appointment with me, it's 2 hours, right? So we've got dental hygiene, and I love that you guys offer checking the oral biome, right? We get an oral biome test. You have a CBCT scan, and so maybe explain what that does for patients. I always say, definitely, go to an office that has the CBCT scan.
Yeah, it's very insightful. It gives a lot of information. You can imagine, so a regular x-ray is 2D. It's basically a piece of paper. You can go look at it and you can get some information with that. But a 3D, a CBCT scan, full circle around a tooth and the jaw and the mouth, and you can see everything there. So whether it's a hidden infection in the tooth or the bone, you can see the sinuses, you can see the nasal cavity, you can see the airway, and all those can have impacts on your health, your systemic health, your oral health. So
yeah, how does it work? Because I remember when you're looking at it, you can tell exactly where there might be some, like you said, cavitations or things like that. So it gives you a number. So is it like a decrease in number?
Yeah.
If there's...
Well, what that's called, you're referring to Hounsfield units on the scan. It's a measurement tool, and it's measuring the density of the bone. So bone, like the jaw, certain parts of the jaw, or a tooth would be a very high positive number because it's very dense. And bone in the jaw, some parts of the jaw is more a trabecular bone, and it has more kind of airflow. I mean, for lack of better terms, you can describe it as more like a honeycomb type consistency. But there'd be fluctuations of density, and some areas might be a little bit lower, or even some areas might be negative numbers. And we start to see clumps of negative numbers, and that you start to wonder, or it raises a red flag. Okay, is something going on here? Is the bone not as dense as it should be, and why is that happening?
Yeah, which I think is so important, right? To detect that. Okay, well, why is that bone density? You don't want to lose that bone density. That's what's the anchor for your teeth. So, and also because every tooth is part of, the meridian lines of an organ as well. So then if it starts having an issue in a tooth, then it's going to affect your entire system.
Yeah, exactly.
And I'm
sure.
Well,
everyone's different, right? Because it's really dependent on your immune system. Some people have robust immune systems, and they can tolerate small defects or deficiencies here and there. But some people, it eventually stacks up, and eventually you get to a teetering point where now your immune system can't handle this load of toxicity, or sometimes viruses, mold, fungi, or even parasites. And so everyone's different in how they respond. So it's not a one size fit all, right? And typically these spots are related to where a tooth was, if you had a tooth taken out. So it's not something where just can happen anywhere in the bone and we're scanning for it. There's normally a cause. If
you see that primarily wisdom teeth, correct?
Wisdom teeth's a common spot because most of us have wisdom teeth out for whatever reason. I mean, that's a whole nother story, but yeah, typically where a tooth was taken out, if there was infection left behind, if there was ligaments or other tissue left behind, and it just didn't allow the body to fully heal and
this is where
that.
I'm trying to connect the dot, because I said, well, okay, why do some, right, can heal just perfectly after extractions?
Right.
And why some don't, and where over time it causes these cavitations with loses the density of that bone in that area. And I'm thinking it as a lens of a nervous system. Was that person under a lot of fear or leading up to that surgery? Because we know that when that person is in fear, they won't be able to heal properly. You know, the oxygen, the blood flow, everything is constricted, even the nutrients to that area. So it won't provide the right environment for it to heal. So now I'm trying to think, wow, okay, if the patient, so I'd be curious to do a test study, you know, of your patient and asking them, the ones that couldn't heal, where you're scratching your mind, like, why is that infection not going away? Are they living in fear?
Yeah, I think you mentioned meridians, and I believe the body is full of energies, and both internal, external, and things impact us and can change that frequency within the body. And emotions is a big part of it. Yeah. And people, just the other week, I had a patient come in, broken down tooth, had to get it removed. But she's been coming back the past couple of days, and it's like, everything looks great, but she's like, I just don't feel well. And I think your body's detoxing, it's cleansing it out. But the other part we talked about, okay, well, how are we supporting our body?
Yes.
Are we supporting the immune system, the nervous system? Are we doing extra things like vitamin C, IVs, or glutathione to help detox? I think infrared therapy is really good. And emotional part's a big part of it. So are you with that anxiety and that fear, whether it was in that moment or whether it was past trauma that you're carrying with you? Like, is that creating a block that your body can't get past?
Yeah, because how many people you hear, that is the block.
Yeah.
Is the fear. They're not.
So do we need to do body work? Do we need to do, have a good friend that does, what do you call it? I guess we'd call it body talk, where she can emotionally help you release any fears or traumas. Yes,
through in the fascia. Yeah, I have a friend who actually I'll be.
But it wasn't even necessarily. That's one way where you through touch and manipulation, but also just through the energies. And she would be
actually
able
I work with a lady with my kids for that. Lately, and it's been a huge help to release anything that was still stuck in their body. For example, my kids are still stuck in their body, the trauma of losing their dad. You know, my son being upset that his dad is gone, that he took his life, you know, and that's still in his body. So we're working energetically to detox that. And so that's where I'm thinking in dentistry, the shift, the holistic, the biological. What if leading up to their surgeries, you know, we tell them to do this guided breath work, you know, or you as a provider, the dentist, before you start, let's say, hey, let's break for 1 minute, or while you're doing local anesthesia, you know, you got to wait till it's numb.
But that's part of the fears too.
Yes,
like how many people come in saying they're scared of the needle. And that's where the fear comes in. I think it goes even before that, whether we dive in, okay, let's get you on a homeopathic protocol that can release these anticipatory fears, or what my philosophy is, what's going to make you most comfortable. I can do what we can do here.
The environment of the dental office is who doesn't like hearing all the drills, right?
Exactly.
Some people don't like the noise.
The smells of dentistry is triggering. Yes. Our office is designed we want it to feel, and you haven't been to our new office yet.
No, I haven't. I'm so excited to see it.
No, so it's still in process. We're still kind of bringing things in, but it should feel like this, like a living room, like you're sitting in a living room and it's comfortable. There's no triggering dental smells. It shouldn't be a white space that, you know, often hospitals give that vibe, a sterile vibe. It should be comfortable, and you should know that coming in, you're going to be listened to, you're going to be heard. How many times, you mentioned earlier, how many times do people say they're scared, but also how many times do people come in to see the doctor or the dentist and say, you know, they just don't listen to me.
Yes.
I don't feel heard. And so the biggest compliment to me is after we're done with the whatever appointment, they're like, this was different because I felt like you actually listened to what I was saying. And whether it was 5 minutes, whether we sat down for 20 minutes, and it's just making the person feel like they're not crazy for having ideas or thoughts of their own body, because they should. Intuition's a very powerful thing.
Yes.
I think you trust your gut in a lot of decisions, and it will guide you to where you need to go.
Absolutely.
So anyway, that's a big part of it, trying to...
Yeah, I think even, sometimes I leave on the lead aprons, right, for x-rays. It's just having a weighted blanket to calm them and take a few breaths. And definitely, the sounds, the smells, if we shifted that, and also, of course, the dentist, the provider, right, because we're so close to them. So making sure you're regulated, and so am I when I'm coming in to treat.
I like the idea of breath work. That's very cool. And I think that can be help. And like you said, weighted blankets are very helpful. Essential oils can be soothing and calming. Just if you want to listen to a podcast, or if you want to listen to an audiobook, or
some
music,
frequency, right? If you had frequency music.
I'd love to have the like sound baths and the bowls come in, and that would be cool.
Because I have those, actually, I have it in my car. Before I start at each podcast, I actually was sitting in front of the red light. I do my prayer in the morning. Like, I have a series so that I'm so grounded, and so my nervous system is regulated, and then that way this conversation flows. We're in coherence. I'm calm. It comes from the heart. And it's the message that needs to be heard. And this is where I think there needs to be a big shift. And that's what I'm talking. I'll be talking in Texas at the TDA conference. And it's all about bringing breathwork in the dental office, not just for the provider, but for the patients as well. Because I don't know, this is from my own observation. The ones that are not healing from maybe, taking out extractions or root canals, things like that, I'm kind of curious, like, were they in fear, and the prolonged state of fear halted their healing?
Yeah, and even while they're healing after the procedure, are they worried on how they're going to heal?
Yes.
Things are sore and uncomfortable. Is that causing more? Am I ever going to get better? Did I do the wrong thing? Did I make the wrong choice?
Yes.
There's a lot of things that are out of my control but they're in the control of the person. But we can manage what we can in the office in that moment, and implement techniques, and create an environment that's soothing and open to that healing. But we have to go deeper, really, into our own personal journey. For example, you mentioned your son healing. Well, my son, he's 1, but we're working on trying to heal him through the trauma he had at birth, because he was in the NICU and for whatever reason, but he spent 18 days in the NICU, and then he had very weak lungs, and then at 2 or 3 months, he had to go back into the NICU because he got RSV.
Oh, wow.
And so that's a lot of trauma.
Yes, that is a lot of birth traumas. I've heard
so
all about that.
So now is he going to have a fear of doctors and go in the hospital? Maybe.
Yeah, his nervous system too. All those bright lights. Yes, I've listened to a podcast, a doctor that talks about the birth traumas and the kids and their nervous system. And oftentimes tongue-tied is actually a nervous system issue as well, where they're so wound up,
Yeah, well, that's a cool window to look into, because the tongue, naturally the tongue should be positioned on the roof of the mouth. And if it's not there, sometimes kids resort to using a pacifier or their thumb, because that pressure on the roof of the mouth completes the circuit and the meridians and the energy flow.
Okay, my
which
son.
is calming. So if the tongue's not going to do it, they're going to want to find something else to do
my son was a 2-finger sucker, and his nervous system, now I didn't know then, but the colic and tongue tie, was his nervous system, the birthing, because it was C-section, but also mentally, where I was at, living under a lot of fear throughout the pregnancy, affected him and his gut issue and all that. So now I know, so much more, but how the nervous system plays such a role in all that and doing the proper integration like you're doing for your son, implementing these tools for him right now.
So a lot of body work, craniosacral therapy, things chiropractors have been helpful. I learned from a chiropractor one time, and it made sense because as she was talking, okay, the primitive reflex that we hold on to that sometimes is a blockage to all this nervous and emotional things. And she says a common reflex of the kids that are holding on to this primitive reflex is they have their hands in the air. And then I thought back in the dental chair, I was like, there are a lot of kids as you're working and just looking in their mouth or whatever, their hands go right up to their head.
So true.
Did you notice that?
Yes. Oh my gosh.
It's because this is this reflex and this is whatever cause. I mean, I'm no expert in that, but I should talk to her more. But it's because of this reflex they're holding on to. And in our world, it's like, no, we don't want the hands by your face because we got things going on. So it's always put your hands down, put your hands down. Yeah. But they're doing it because they're subconsciously, that's like their reflex to protect themselves, or they're on guard. So it's very interesting. The
fear. So helping teach the body that they're not being attacked, so that survival mode. And that's for me, when I was in such that fight and flight after my husband passed, I had to really learn that resilience and show my body that I was safe. So I did a lot of body work and cold plunging and breath and all of that, just so I can build up that resilience. And that's where I think this is such an important tool for bringing it back to dentistry. If we really incorporated these tools, I think we'd see a shift, because right now it's really confusing. So for example, there's so much talk about root canals, right? Leaving something dead in the mouth and harboring these bacteria. But it doesn't affect everybody. So, but it also creates fear. I also, posted some information that's about root canals, when I had biological dentists on. And I do notice how sometimes this information creates this fear, right? And that's not what I want. I do want for people to become their own health advocate, to know kind of the truth, the root cause of everything. But also I don't want to create fear, because I feel like that's worse.
Well, so much of the world, both sides, whether you're on the allopathic medicine, alternative medicine, whatever, there's fear mongering on both sides, really. And I agree with you. We don't want to create that fear. It's just empowering people with knowledge.
Yes.
And so that they know the pros and cons of all of the options they have available to them.
Yeah, and maybe can you describe that? What's your point of view for root canal in particular?
Yeah.
That's I know it's never black and white, but can you explain it? Yes, once you remove, pretty much you're removing, it's the tooth's immune system.
Yeah, you lose the vitality of the tooth,
yes.
Right? If you got gangrene on your finger, are you going to just, treat it and let your fingers stay there? No, probably you got to get it amputated, right? So if we're amputating the root of the nerve of the tooth, then why are we just leaving the shell of the tooth there that has no vitality left to, and no connection to the body, really, right? So that's some of the concern. The benefit is, okay, you get to keep your tooth, and sure, there's some benefits to that. But if your body and your immune system can't manage the different bacteria that are culminating in that spot, then what do? Your body compensates otherwise, and sometimes that leads to downfall in other systems or organs in the body.
Yeah, depending on how healthy the entire systems were, right?
Again, it's back to how everyone's immune system functions and what they can tolerate. But it's the best way, I'm looking at these plants and things behind you, the best way to describe a root canal is, so the nerve of the tooth, you have a trunk like a tree. And so that's really easy to clean out because it's obvious where it is. But trees and plants have branches and everything that goes all over the place, and hundreds and thousands of millions even branches. And so how can you clean that all out? You can't. So with the root canal, you clean it out, you do the best you can, try to seal everything off, but you still have all these branches and these tubules and pores that are going back and forth that can still have some nerve tissue and some bacteria lingering there in your body. If it's too much for the immune system, doesn't know what to do with it.
Yeah.
So,
And I'm always about optimizing your health, right? Mm-hmm. And if we really want to optimize your health, why would you leave something in your mouth that can, cultivate bacteria that you don't want, right? And compromise your immune system. Right. So that's kind of where I'm at. There's no, black and white, but just, empowering people of that knowledge. And I love the way you explained it. It was simple. People can understand it. And it's the truth. Yeah, it's
the truth. And so with that information, people can decide what they want to do. If it looks clinically fine, then great. We can watch it and monitor it. That's where this CBCT is so important, because we can see things that you can't see on the 2D X-ray. And if there's a clinical issue, well, now you have a little bit more of a push. Okay, the root canal's obviously failed. We got to do something about it. But if it clinically looks good, and it's now each individual decision of, do they feel like it's having overall impacts on the rest of their body and they want to do something about it, or are we going to put it more into the monitoring stage, and we can do other techniques like ozone to help try to stabilize it.
Ozone. I love the ozone. Yeah.
So there's tools for whatever decision we go, but you hit the nail on the head that we just want to optimize the health and optimize the healing in the body, no matter what technique or decision is made.
Yeah. If you had the decision, now you're aware, you have this information you can't go back at yesterday, but now you have this information.
You can't change the decision that you did the root canal.
Yes.
But now you have a new decision of how to manage it.
And, I always tell people, because they're like, well, what do you do? Where are the options? For me, I said, well, you can put in an implant, but I always say, preferably do a ceramic implant. Is that what you would recommend instead of a titanium? Because you don't want metal in your mouth.
There can be metal responses as we're talking about the nervous system. Any sort of metal is an antenna, really, and is that drawing frequencies into the mouth and into the body, maybe, right? So that's something to be cautious and aware of.
Absolutely. Oh, yeah. I mean, we're all energy. So you've got to, I notice it even in working in a dental office, you hear all the sounds, the drills, and sometimes you're kind of sensory overload by the end of the day because of all that. And I think most of our environment nowadays is kind of affecting our nervous system. So that's why constantly grounding and the sound bowls that I have and breath to regulate ourselves, time in nature,
Yeah,
and actually
another one, the best one is just being out in nature and getting your feet on the ground.
That's always calling for me. I'm like, oh, okay, we got to go. I actually, Monday, that's how I felt. I was like, okay, we got to go Canyon Lake. We got to go kayak. We got to go out there listening to all the birds. And even this weekend, I'm like, should we take the RV? Let's go out.
Well, we moved here not too long ago, and I think I've told you that we moved down from Canada, actually. Yes. And it was easy in Canada because we lived in the forest. We lived right by a glacier river.
Yeah, which part were you in again?
Calgary, Alberta.
Oh, well, Calgary. Yeah, I lived there.
So right by Banff National Park in the Rocky Mountains.
I know. I was always up in Canmore. I'd always go up there.
Right by our house. Yes. But so it was easy there. It's a little bit more tricky in Arizona. You have to kind of drive to get out somewhere. But even in your own yard, it would be beneficial.
Oh, absolutely.
Get in the garden or whatever.
Yeah, garden. I mean, I live in Agritopia. There's Agritopia Farm, so that you can have your own place to, grow your vegetables and whatnot. So, I think it's so important to be aware of that and then where you're coming in and deciding what to do and what's the options. And that's why I would like to put out this information, is just empowerment. And also because I also observed my husband he was actually really good at root canals, but I do remember the constant calls, the emergencies. And it was even a friend, the infection kept coming back. And he was just a perfectionist and was like, I couldn't figure it out. Now this is why this all makes sense. I'm like, oh, well, that's connecting the dot as to probably why, and if we didn't have a CBCT scan, then we'd be able to see maybe a little bit more what was going on,
Yeah.
And
it's interesting.
yes, yeah.
Think back and what could have been changed, or, what were we missing? And, it's really, I think this style of dentistry is on the cutting edge of dentistry. It's here to challenge the norms of dentistry and healthcare in general.
Yeah. Yeah. Do you find it hard, like with even other dentists friends that you have, if they're doing general, what do they think about what you're doing and what you're incorporating?
I just ask people just to have an open mind,
Yeah.
right? It's not like we're doing crazy stuff. You walk in the office, it still feels like a dental office. It doesn't look we try to make it look different and more comfortable, but still you have a dental chair and, the regular dental equipment. But being open-minded is the biggest part. I had a friend coin at one time, just be an open-minded skeptic, right? Open-minded, okay, let's go through it and, look for the evidence and prove things are right. And there is a lot of evidence. There's a lot of science behind it. There's a lot of background. And it's not just this hocus pocus.
Well, I'm sure you see it. Yeah, you see it on a daily basis. I'm sure you could share some
daily
stories.
Daily basis of people coming in and say, I did this, and this is better. And it's like,
and one thing I'm curious.
How can I prove that? But I'm also not calling you a liar. You're telling me that now this issue is better that you're dealing with just because we managed a root canal or mercury fillings or whatever it might be.
Yeah, I'm glad you're bringing that up, actually, because I am really curious from the patient's base that you've had, some that had cancer, let's say, or chronic illness. And oftentimes I feel the mouth is kind of the last place that they look, you know, as sometimes where it was coming from. So from some cancer patients that you've had in your chair and what's going on in the mouth, do you see a correlation and where, infections? And like, what do you see story-wise?
There are even studies around that, right? How an infected root canal or an abscess in general can have impacts on cardiovascular health and Alzheimer's and other systemic conditions. So that's pretty well documented. But what I've experienced is people, come in, and often it is the mouth is the last place they check. But I think health starts in the mouth a lot of times.
It's like a mirror, I say. Yeah.
And I wish more the medical world would be, okay, well, let's just check the mouth. What's the harm in checking the mouth to make sure everything's okay, whether you have gum disease or a cavity or a bacterial overload or infections? Because I have seen people heal through managing those infections that are in the mouth, whether it's through arthritis, joint pain, or I have had people say that they're in cancer remission or their tumors are gone and their breast cancer, whatever, has changed and they're in now remission, but the only thing that they did different was manage that infection in the mouth.
Okay. Yeah.
So how do you argue that?
Right? Yeah, exactly. You can't argue what you observe, what you see. And just, I think I've heard that a lot too, where people, I have a friend where from an abscess, from a root canal, then she almost had a heart attack. She has a stent now in her heart. So, but when they go to the hospital, I know for us, if we weren't open the Sundays and they're sent to emergency, they're not prepared at the hospital to even check in the mouth and have the knowledge. So then they have to wait till the next day, or they don't even correlate it to maybe her heart issues either. They deny it. So there needs to be almost a communication and understanding that is a mirror to your entire health. That's what I say. For years, I literally could look in, you look in someone's mouth. I was like, I could tell the amount of stress they're in, the fear, the anxiety, what their diet, some of the medication, of course, what it's causing if they've done a lot of drugs. And, there's so much. I see a whole story inside the mouth. Yep. And so 100%. It's a mirror. And I think it does.
And that's often the first sign of other things going on is what you see in the mouth.
Exactly. It's the body's, speaking to us. There's something underlying, like even if you have an infection, well, why is your immune system down? What's happening inside your body? Are you living in a lot of fear right now? Are you in a lot of stress? Or there's something you're not willing to see? So your body will start to speak to you, right?
Yeah.
And that's why illness.
If you listen.
If you listen, I got to be willing to listen. And one thing that I wish, be incorporated more in the realm of science and the medical industry is really blending faith.
Yeah.
Blending faith. I feel even if we prayed, not picking one faith, but just asking the patient if however they like to pray, or do you mind if we just speak just light and gratitude and just before we start.
Just understanding in general that there's something more than here, right? No matter whatever you want to believe in, whether it's God or energy or light or whatever, there's something more. And that's both innate in ourselves, but also in the universe as well.
Yeah, higher power, that there's something else out there. So even starting just starting out with the patient, before I start cleaning, hey, do you mind if I just do a short little, prayer and then we start, or just to put you at ease, to just make sure that we're changing, kind of getting into that, I always say the heart coherence, just to calm them. I'm always giving them also the upper hand. Sometimes I'll say, okay, if at any point you are uncomfortable, just raise your hand,
something to disrupt that frequency that they're coming in of stress and anxiety.
Yes.
You need to disrupt that somehow. There's lots of ways to do it, but that's very important, I believe.
Of course, in a dental world, time is always a bit of an issue. And I love at your office, you just allow yourselves to have more time, which, and oftentimes now it's like, okay, no, 1 hour, like I barely have time to eat, to drink or anything. It's like 8 hours, boom, boom, boom at most offices. But if we spent more time to really help them and calm, because in that energy as well, they're going to be stressed, they're going to feel rushed, right? And nobody likes that, right? And they want that connection. And ultimately, they want to trust you as the doctor. Oftentimes, a hygienist, I remember, they're like, oh, is he telling the truth? All dentists want is money. And I'm like, hear that so much. I'm like, yes, like he has your best, most have your best interest. And so it's building that trust too. And that takes time. So allowing more time and connection will allow just so much more healing on a whole for the patient and for you too. I mean, it'd be a lot to just go and try and just be rushed through patients. That won't be good for your nervous system,
No, 100%. One thing that came to my mind was, if there's one thing, there's lots of things I admire about my wife, and as she's a mother to our kids, and with mothers in general, is just how real and true a mother's intuition is.
Yes. And
through our experiences with our kids and raising our kids and through their health journeys, and a lot of times choosing the alternative paths and going against the mainstream forms of medicine, how right she's been in just following her intuition. That's really powerful.
It is. That's what my next book is. The God Connection is all about empowering you, your body, your intuition will tell you.
Yeah.
Tell you.
But I think mothers and women have an extra superpower.
Yeah, I think so too.
It's definitely more than I have, for sure.
I think so, but that's okay. But at least you're seeing it and you're willing to trust her and also support her in her decisions. That's what we need from the masculine, from the man, is that, we're very into it. I am too. And whenever I'm speaking, to my boyfriend, I'm like telling him, he's like, oh, okay, I didn't feel that. But that openness to support and to understand it and to trust it. I remember hearing this speaker as well, this world speaker in the health industry. And he says, oh yeah, I'm such a believer, I trust everyone. But now first they have to go through my wife because she can really decipher who's in it for the money, who's in it with the heart. So
it's very powerful.
It is really powerful.
And a lot of times, a lot of our clients that come in are mothers, and they bring their families. And it's cool to see that intuition work in their families and their lives with their health decisions and everything. And it's actually my wife was the one that directed me into this style of dentistry.
I like that.
It was her, pushing and nudging to, hey, let's look more into this. And because in dental school, you don't learn any of this, right? Yeah, there's so many things we should be learning, including airway and breathing and all that. But
even, don't you think, you mentioned earlier, not to cut you off, but I don't want to miss it, with mercury.
Yeah.
Right? You mentioned the mercury. It's not something that'd be taboo to talk about, at school. Yeah.
Oh, definitely taboo. But oddly enough, the FDA has come out and there's been statements against mercury for women and pregnant women and kids. And to me, I just think, well, if it's not okay for them, that's that subpopulation. Why is it okay for anyone, right? Also in dentistry, we're regulated through our suction lines, and as you suck things up, at the bottom of the line, the tracks of the line, there has to be a amalgam separator, a mercury separator from the general water supply. So, well, why is that a regulation? I thought it was all okay and good and healthy, right? But there's just these odd things that, aren't really so odd because once you know. Yes. But why is in the main world, is that okay to have those sort of regulations, but we just put it in people's mouths? And
I know.
That's okay where I'm there, but it's not okay to have it, in the water, or pregnant women or kids.
I know, it's just like, it doesn't make sense because we know, our body knows it shouldn't be inside our mouth.
Yeah.
And
you definitely shouldn't play with it in your hand anymore. That's common knowledge, but it's still good to put in your mouth.
I know. Well, that's the thing. That's why I think for dentists that do place the amalgams, that remove them all the time, to be aware of that. I'm always curious. I'm like, gosh, if we tested every dentist for mercury levels, I'd be curious to what they're at.
That would be a very curious.
Yeah. Have you ever tested? Have you yourself for mercury levels?
Yeah. I pride myself in saying I've never placed a mercury filling in someone's mouth.
Okay.
Not even in dental school.
Wow, that's good.
Yeah.
Okay.
So that's kind of cool. But I've tested myself. We do what's called the SMART protocol. And so if we're taking out a mercury filling, we're doing extra precautions with ventilation and masks and, helping the body detox and clear that out. So I feel like that's protecting us and the clients that come in. Yeah. There's been studies actually done that show, so just as, for example, they had a extracted tooth outside of the mouth, amalgam filling outside of the mouth, and then take a pencil eraser and just rub the eraser outside of the mouth and create friction. Then they put it on a smoke screen, and you see the mercury vapors releasing.
That's right here, with
releasing
the heat.
from it. Yeah, with the heat and the friction. I was like, well, that's what we're doing in our mouth as we chew and eat and drink hot and cold things. So that's got to be happening somewhat. And then as you cut into a tooth, well, that's definitely releasing more vapors. Mm-hmm. So that's why we do the SMART protocol, because it's releasing and we want to protect everything. But there's just having it in your mouth as metals expand, contract, there's release. And
isn't that what they place on kids?
Yeah.
Right? Because it's cheaper.
It's cheaper. It's easier to use. And, it does last a long time, but that's because I see teeth fracture and break far more than I've ever seen one of those silver fillings break. But so that's why it's done. And, it's hard for things to change when you've been doing it for years and years and years, and generally accepted by the
But now we're aware, and I can't not see that.
And I think the trend is going more that way too, where, with mercury, it's becoming more known of the impacts of the fillings in the mouth. Fluoride, for example, is, going through lawsuits against the EPA, challenging the water fluoridation.
Yeah, because it affects the fluoride, the bone density.
Yeah,
bone,
IQ levels.
IQ, exactly.
So lots of studies on that. And just questioning, okay, how much benefit does it give to the teeth? And does that outweigh all the risks of it?
Right.
And so that's becoming more and more studied. And I think the trend's going that way. I think the trend in 15, 20 years is going to go more towards biological. And so that's why I say we're on the cutting edge and challenging
You're really
the norms.
the only,
because we've been doing it for 10 years, 10 plus years, right?
I love that. I love that you are. You know what I love? There's so much I love about you guys, the office and what you provide and you as a provider. But as you as a provider, what you mentioned, that you are open to trust a mother's intuition. How often have I gone to a provider as like, something's off for myself, first of all, but especially my kids.
Yeah.
And I'm like, no, everything's good. Everything's good. Or you're told you're kind of crazy. You're a hypochondriac. All the things, but I know I will find someone that could see me and your openness right there, that is hard to find.
Well,
that is really,
appreciate
really hard
hearing
to
that,
find.
but it's sad that it's hard to find.
Yeah.
But so many times, almost maybe every day, that people will come in and like, this is off. It doesn't feel right. And so, okay, let's do our checks. Let's check things out. And it's like, as far as I can tell, it looks okay. But I hear what you're saying. I don't know what you're feeling, only what you're telling me. So something's there. And whether I can find it in this moment or not, more often than not, it eventually manifests itself. And like, yeah, you're right. Something is there. Like I couldn't physically see it or physically feel it because, I can't live inside your body, but I trust what you're telling me. Eventually we'll get to it. It might take a little bit more time to be sure, because we don't want to just, go rogue and, start doing all these different treatments when we don't know what's the right treatment.
Yeah.
So sometimes it takes patience as well to figure out what's going on.
Yeah. I like that. I love that. So now, how can people find you? I know you're here in Arizona. You're out in. Do you say that you're in like a Gilbert or you're in Mesa?
The office, it's right on the border of Gilbert and Mesa. It's right by the Mesa airport. So on Power and Ray are the crossroads. Okay. So we've recently switched our name up to Elite Dental and Wellness. Okay. And really emphasize on the wellness part.
I like that.
The name used to be Elite Smile, so you might still see that name here and there as we more transition the new branding and the new office space, which you got to come see.
Yes,
I think you'll like it a lot.
Oh yeah, I want to fill in. I want to come in and work there. Yeah. That's the only place I want to work now.
Yeah, so that's the main thing. You can find us on our website. Yeah. We got to build up our online presence as well.
Yeah.
A lot of people have said and come in recently, like I didn't even know this was a thing.
Yeah, you were hard to find because I was looking in the beginning. When I was looking for biological dentists, I found some other ones here, and until I dig deeper, and then I found Elite Smiles, and and I called and asked all the questions.
That's got to be easier. We got to be easier to find for sure, which we're working on. But just in general, these people are saying, I didn't even know biological dentistry was a thing.
Yes.
And it's like, well, okay, that's interesting. I mean, it's pretty out there.
That's why I'm podcast so much about,
there's podcasts like you. There's, like you mentioned, Michelle Jorgensen. She has a big outreach. I'm actually going to have
another one, Dr. Perea. So I'm becoming the voice for it because I want to help shift the industry.
Yeah,
I want to bring that awareness, and this is why I have you on today. In February, I'm having Dr. Perea. She's called the Whole Tooth Dentist out of Texas.
Nice.
And I met her actually in Sedona. I co-hosted a retreat for dentists in Sedona, and I met her, and she was telling me all about biological dentists. So I can't wait. So I think I'll just keep having more and more come on to just.
Like I said, I feel like it's the new wave, and we'll have to do a better job getting more out there and
I can help you when I come work. They all do little reels. I'll do
there we
all
go.
things.
Can you be our social media
I can
manager?
definitely. Yeah, there you go. I figured it out now.
Yeah, that would be great. But it's the way I think things should be and the way it should go. And it's getting there. But I think, as you've experienced and hopefully others, that our office does a good job in delivering that.
Oh, absolutely. Absolutely. And what's the website? I know I'll have it all in the show notes, but if anyone's listening, what's the website?
Elite Smiles AZ. Okay. So again, that domain might change the name slightly to
but
match
I'll
our
leave it in the show
branding,
notes. And if it does change, I'll change it in the show notes as well, because this episode will be there forever on all platforms. So
so elitesmilesaz.com.
Okay.
And myself, and we have another doctor there, which you've met as well, Dr. Blake Shreve, two wonderful, amazing hygienists, hopefully to add a third. But it's
they're
a really,
fantastic. The whole
really
team.
good team.
That's why
they are very knowledgeable.
Now both my kids have gone through. I have. My mom still needs to book, but that's why I had to go first and before I recommend. But you're honestly the only ones I would send my whole family, or I recommend.
Well, that's so kind. Yeah. I appreciate that.
Well, thank you so much for coming today. It was so fantastic. And I hope anyone listening here that was curious about biological dentists, please follow Dr. DeSanti in the show notes, the office, or share this episode. Bring that awareness, give that power, and always trust the mother's intuition.